Welcome to my channel Medicine Guide. Tirzepatide, sold under the brand name Mounjaro and Zepbound among others, is an anti-diabetic medication used for the treatment of type 2 diabetes and for weight loss. Tirzepatide is administered through subcutaneous injection, under the skin. Side effects. The most common side effects include nausea, vomiting, diarrhea, decreased appetite, constipation, upper abdominal discomfort, and abdominal pain. Glucagon-like peptide 1, GLP-1, and glucose-dependent insulinotropic polypeptide, GIP, are hormones involved in blood sugar control. After a person has eaten, these hormones are secreted by cells of the intestines, and in turn cause the secretion of insulin. In this video we will discuss the pharmacology of tirzepatide. Now let's start our discussion. But before that, please subscribe to my channel Medicine Guide. Tirzepatide is a GIP-analogue that activates both the GLP-1 and GIP receptors, leading to improved blood sugar control. Tirzepatide is a glucose-dependent insulinotropic polypeptide, GIP, receptor and glucagon-like peptide 1, GLP-1, receptor agonist. Tirzepatide was approved for medical use in the United States in May 2022, in the European Union in September 2022, in Canada in November 2022, and in Australia in December 2022. The U.S. Food and Drug Administration, FDA, considers it to be a first-in-class medication. It was approved by the FDA for weight loss in November 2023, under the brand name Zepbound. In November 2023, the UK Medicines and Healthcare Products Regulatory Agency revised the indication for tirzepatide to include treatment for weight loss. Medical uses. Tirzepatide is indicated to improve blood sugar control in adults with type 2 diabetes, as an addition to diet and exercise. Tirzepatide is also indicated as an adjunct to a reduced calorie diet and increased physical activity for chronic weight management. Contraindications. Tirzepatide should not be used in people with a personal or family history of medullary thyroid cancer or in people with multiple endocrine neoplasia syndrome type 2. Adverse effects. Tirzepatide exhibits adverse effects similar to those of other established GLP-1 receptor agonists, such as dulaglutide. These effects occur largely within the gastrointestinal tract. The number of patients who discontinued taking tirzepatide also increased as dosage increased, with patients taking 15 mg having a 25% discontinuation rate vs 5.1% for 5 mg patients and 11.1% for dulaglutide. To a slightly lesser extent, patients also reported reduced appetite. Other side effects reported were dyspepsia, constipation, abdominal pain, dizziness, and hypoglycemia. Pharmacology. Tirzepatide is an analog of gastric inhibitory polypeptide, GIP, a human hormone that stimulates the release of insulin from the pancreas. Tirzepatide is a linear polypeptide of 39 amino acids that has been chemically modified by lipidation to improve its uptake into cells and its stability to metabolism. It completed phase 3 trials globally in 2021. Mechanism of action. Tirzepatide has a greater affinity to GIP receptors than to GLP-1 receptors, and this dual agonist behavior has been shown to produce greater reductions of hyperglycemia compared to a selective GLP-1 receptor agonist. Signaling studies reported that tirzepatide mimics the actions of natural GIP at the GIP receptor. At the GLP-1 receptor, though, tirzepatide shows bias towards CAMP, a messenger associated with regulation of glycogen, sugar, and lipid metabolism, generation, rather than beta-arrestin recruitment. This combination of preference towards GIP receptor and distinct signaling properties at GLP-1 suggest this biased agonism increases insulin secretion. Tirzepatide has been reported to increase levels of adiponectin, an adipokine involved in the regulation of both glucose and lipid metabolism, with a maximum increase of 26% from baseline after 26 weeks, at the 10 mg dosage. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guy.